I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on tear drain stents. Now, when we do a watery eye surgery, keyhole watery eye surgery, we often put in stents, little rubber tubes to keep the upper tear drain opening. This is a very interesting video where I'm going to show you inserting a tear drain stent after the DCR surgery. The reason I had to insert it was because the opening had a fold over it, and it was acting like a valve to block the tear drain. So, despite having a successful procedure, she still had watery eye. And this lady was lovely, and I just said, look, we'll just pop one in. And in fact, I could do it in the office. So this is what it looks like. Here we see a person who has an opening. You can see a wide opening with that movement. That movement is the tear pump. And right at the top of that, there's a little opening, and that is the common canaliculus. However, there's a flap. I put a drop in the eye, and fluid does get through, but it doesn't get through fast enough. There's the tears draining into the nose after a dacryocystostomy. It looks like it's functioning. There's the other side of the nose, nothing there. All right, so here it is, it's draining, but it's not draining fast enough because there's a fold, and you'll see that now. I'm passing a probe in, and the probe struggles to get into the nose. So I pass it from the eye into the nose. And here we go, I'm really struggling, and there it is, there's a fold over it. It's a little fold, and I'm just trying to get through it. So that fold can happen after surgery for a whole number of reasons. So here we are, I pass a tube in. It goes through the eye, into the tear drain here, and you'll see I struggle to get it. There it is. Good, grab it, pull it out. So that's the first one through the bottom of the tear drain. Then, to tie it together, we put one through the upper tear drain. And you'll see what happens here. Initially, it doesn't pass into the correct position. I've got to pull it back and get it beyond the fold. It passed through the fold rather than around it. So I pull it back. There we go. There's where it should be. And we pull that out and then tie it all together. So that's a tear drain stent. And what it will do is it will stretch open the fold, the opening there, and hopefully over time, that fold will retract away from it. So there it is there. That's what it looks like after I put the tear drain in, the stent into the tear drain, and it's tied off. So for those of you wondering how I do it, that's what it is. I hope that all makes sense. As always, if you've got any queries, you can get in touch with us in Sydney. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery, and thank you for watching.